Hello, I'm Andrea Magruder, and I will talk about denial predictors for facilities. Within the denial predictor, we will identify, analyze, and the goal is to receive a decline in denials. We will start off by defining what is a denial. A denial is a claim that has been processed by the insurance carrier and found to have been unpayable or unreimbursable. These claims typically contain some sort of error or lack of prior authorization that became flagged after the claim was processed. There are top 5 denial reasons any one facility can receive. This includes anything from no authorization to needing additional information. Statistics say that 86% of denials are potentially avoidable. And out of all of those denials, only 14% are unavoidable. Who is the culprit for denials? Well, that depends on who you ask. Each entity blames the other. If you ask the insurance company that question, they will likely tell you the provider is billing correctly. If you ask the provider, they will tell you it is the payer's error. Handling insurance claims and the denials generally result in a manual process. It requires careful review of all the claims that have denied. I know it sounds quite silly and you would think, well, that's obvious, but in most cases, this most important step dismissed. You have to consistently be persistent, and you can't delay in turning over the denial, or you will result in a loss of payment. In all of that, it is in the best interest of the facility to learn their appeals process, and you have to maintain every step you've taken in order to dispute the claim. Facilities on average receive anywhere from 9 to 12% of their denials, and an average person works about 40 to 50 claims per day. So putting those numbers into reality, if a facility submits 1,000 claims per day at the current denial rate, this equates to 90 to 120 claims that will not pay and require manual review, correction, and then resubmission. This means claim denials can cause substantial loss of revenue for healthcare organizations. Nearly $5 million annually is the claim value per provider for initial denials resulting in at-risk revenue. This means you need to develop an efficient way to reduce the number of claims being denied, as well the time and money spent to rework them. The goal is to dramatically increase your clean claim ratio. And how do you do that? Through denial predictions. Denial predictions allow you to unlock, accelerate, reduce, enhance, improve, and streamline your process through machine learning. This is a type of artificial intelligence that allows software application to become more accurate at predicting outcomes without being explicitly programmed to do so. What it does, it enables the provider or facility denials predictor to continually improve by comparing predicted denials, actual results, and self-correcting its prediction algorithm for the claims that follow. All of this helps improve the organization's performance and bottom line. How does it work? First step, it utilizes historical claims data. It gathers 18 or more months of historical claims and payment data to configure a model for implementation. It then receives and reviews a claim file from the facility prior to submission to the payer on a daily, weekly, or monthly basis. The third step, it processes each claim through a denial predictor model, and it assesses the likelihood of a denial for each claim. Step 4, it delivers output via the web-based or interface of a file, indicating the likelihood of the denials. And then it also provides the potential next step for the team to take in order to remediate the issue prior to submitting the claim for payment. And then the last step, it retains the model multiple times per year, retrains the model multiple times per year, using new data to continue to produce actionable denials, ultimately generating claims that have no defect, or also known as clean claims, for timely payment. Question: do you think these tools will replace business office staff? Will denial predictions eventually eliminate denials from the insurance company? Are there true savings when these costly programs are purchased? And have you ever experienced an unnecessary denial? If so, who's at fault? The insurance company or the facility?